So we are joined today by Dr. Melissa Heitman, who's one of the consultant respiratory physicians at UCLH and lead on long COVID. Dr. Toby Hillman, who's a consultant respiratory physician at UCH and works in the long COVID clinic. And Rebecca Livingston, who's a clinical lead physiotherapist and works in the long COVID clinic. And this is going to be provided on behalf of all the clinicians in the post-COVID services in North Central London. Okay. So obviously, welcome everybody. So the webinar will be about 45 minutes in total and will comprise of about 30 minutes of presenting, followed by about a 15-minute question and answer session. So the speaker presentations will be recorded and available for future reference. So please keep your microphones and cameras off during the webinar. And please do not share the webinar with sort of other people other than those that are sort of friends, family members, and or carers. Okay. So this is for people that have had appointments within UCLH or North Central London. If you do have questions, please use the Q&A function, which you can see at the top of your screen, which then comes through to us, and then we can pose them at the end in that 15-minute Q&A. If you do wish to post questions anonymously, please click that function when submitting the questions, and then we'll pop those to the panel in the last 15 minutes or so. Okay. So obviously this is the first of 6, so it's our first one, so it continues to evolve, and it's for people that have been through the clinic, and everyone may be at different points in their long COVID journey. Okay, perfect. So I'm just going to hand over and we're going to get started.
Thank you, James. So we wanted to start by just a recap of what we understand by the term long COVID, which is obviously a new illness. And the National Institute for Clinical Excellence, NICE, are the group who've defined a definition of what is meant by long COVID in the UK. And that involves a person who's experiencing symptoms which last for more than 4 weeks after a COVID-19 infection. You don't have to have had a positive test to confirm the infection, but your doctor needs to have considered that that's the most likely start of these symptoms. And in fact, the definition can include a wide range of symptoms. So it's not any particular symptoms, but we've seen that fatigue, extreme tiredness and breathlessness are the most common symptom, often accompanied by a cluster of other symptoms as well. So that these symptoms come together, they tend to go up and down with time. So we use the term fluctuating. And you might also hear the term post-COVID syndrome. And in medical terms, a syndrome just means an illness that has several components to it. And post-COVID syndrome is specifically a term used for when your symptoms have lasted more than 3 months. But long COVID is generally more popular and one that we use a lot in the clinic. And different people with long COVID can have different patterns of illness. And there isn't a simple test that can confirm the diagnosis. So coming to the conclusion that you have long COVID is very much down to the judgment of your GP or the clinic team or other clinicians that you meet. And because we don't have a test that easily confirms that long COVID is the cause of the symptoms, it's really important that the clinicians who look after you keep thinking about whether there could be any other causes of the symptoms that you experience. And that might be why you have particular tests arranged. And sometimes it can take a little bit of time before it's clear that long COVID is the right explanation. Once doctors and clinicians feel that long COVID is the right diagnosis, it's really useful to actually put that onto your sorry about the background noise, onto your clinical record. And that's just for clarity with other people who are looking after you. It's really important that people know if you have a long COVID illness. And although there's a lot of uncertainty in the long COVID sphere, it's really important to say that we do feel that this is a definite physical illness. And research is ongoing and starting to understand it better. I've just lost the slides there, but the research is frustratingly slow. There's an important study that we're involved with at UCLH called the Stimulate ICP study, and we might offer you the opportunity to be involved in this, in particular to try and help us understand the illness better. So if I could have my next slide, James. Thank you. So this is just to show you the way long COVID services are arranged in North Central London. And North Central London is this region of London, which includes 5 boroughs, so Camden, Islington, Haringey, Barnet and Enfield. And as a healthcare system, we work closely together in those 5 boroughs. So people who experience long COVID symptoms need to report to their GP, who will take decisions about the right course of action. They may feel that you, first of all, need some additional tests, for example, shown by the little red house down the bottom. They may ask you to have blood tests, chest x-rays, and sometimes other tests such as heart rate monitors. And they will always signpost you. Well, we encourage them to signpost you to available advice online. And the Your COVID Recovery website is one that is supported by the NHS England Long COVID programme, and it is updated and improved regularly. And your GP will decide if you need referral to the long COVID pathway, and then clinicians in the team will triage that referral, which means they'll take decisions about where's the best place for you to access the support that you need. And very often that will be in the post-COVID clinic, and everybody who's been invited to this call has come through directly to the post-COVID clinic for an assessment. And after that assessment, we work out a treatment plan. And that's where we may need the input of other people that we work with in North Central London. So the 4 different post-COVID rehabilitation teams. And we use a number of different aids to try and support your management of your condition. So sometimes that will be one-to-one support with a clinician. Sometimes it will be linking you in with an app. You may be given an offer of joining groups to tackle a particular aspect of your long COVID. And we try to talk about the patients, the people under our care in meetings, which we call multidisciplinary team meetings, and we hold them on Teams just like we're doing today. And that's a really useful way of trying to keep things joined up. But this has been a really new process. We've been learning a lot over the last 2 years, and we know that there's further improvements we can make, and we're keen to hear your ideas about how we could make the service better. So I'm going to hand over to Dr. Toby Hillman, who's going to talk to you a bit more about long COVID as an illness.
So thank you very much. I just want to check that people can hear me because we're good. Technical, I'm sure you can see I'm in a hospital room, and so that often creates problems with connectivity. So apologies for the slightly small picture on this slide, but what I wanted to do was just go through some of the background as to why we think that long COVID is such a difficult illness to pin down and say exactly what's going on all of the time, and then go through some of the theories about why long COVID, is occurring, and sort of areas which we're concentrating on to see if we can understand the disease and hopefully get to more targeted treatments. So in terms of why there are so many symptoms, we know that SARS-CoV-2 or COVID, COVID-19 enters the body usually through the upper respiratory tract, so that's the nose, and then it goes into different cells throughout the body using something called the ACE2 receptor. Now, exactly what that is not so relevant, but what it is it's the doorway, if you like, that the virus uses to get into cells, infect them, and then start the cells to make copies of itself, and then that's how the virus gets spread around. And you can see on this diagram that ACE2 receptors are present in all of the major systems of the body. So when we think about why COVID, although it was initially thought to be just a respiratory illness, As we go on, we can see why the after effects of COVID can be affecting all of these different organ systems, because they are all possessing that doorway for the virus to get into their tissues. And we'll think about some of the other mechanisms in a moment. So if you just want to go on to the next one, please, James. So this is an incredibly dense and boring slide, but I wanted to put it in to illustrate that the mechanisms driving long COVID are really, they're not very simple. They have been, people are thinking of lots of different reasons why people could be getting the wide range of symptoms which are seen in the clinic and which are experienced by people with long COVID. And there are huge overlaps between a lot of the symptoms which have come to sort of characterize long COVID and other diseases. And so we need to look at each of the different body systems to understand if there's something going wrong which we understand and can treat and we can sort of monitor, or whether there's something new going on. And this is from a paper, if you're interested, the reference is on the bottom there. It's been published just in June this year, and it goes through that sort of 40 or 50 different ways in which COVID may be causing long COVID. And there's a few which you'll probably, which jump out and people will be able to sort of understand, which is vascular damage, so damage to blood vessels, changes in platelet function, and also importantly for some people who've got long-term effects following a critical illness with COVID, and we know that that's not everybody, we can see that the severity of the critical illness and the time spent on ITU, for example, can also have long-term effects. So when we talk about long COVID, we're looking at all sorts of different things, and part of what Melissa said about the definition of long COVID that has made it quite difficult to sort of tease apart these different things is that there is so much overlap with quite a lot of the symptoms and conditions which we knew occurred in other critical illnesses in those people who've been in hospital, but equally we do know that these symptoms and problems are also affecting people with only very mild initial illnesses. So it is a complicated situation that we're working hard to try and understand, and as you can see, this is a synthesis of lots of different papers of research, and there's not one cause of long COVID which we can point a finger to. So if we can have the next slide, please. So there are some key areas of research which are going on, and Mel mentioned the Stimulate ICP trial, and that is a trial which we're running at University College Hospital along with 5 other sites around England, and that's looking at the whole care pathway and looking at medication treatments which might be helpful for long COVID. In terms of things which you might have heard about in the popular press or in reading scientific literature, there are key areas of research looking at blood clotting. So we have seen lots of papers from all different groups around the world looking at why people have what seems to be sticky blood following COVID, and also what that means, because we know in the acute COVID there's definitely people who get blood clots, and we know that in long COVID there are some signals that people who, for example, struggle with exercise, some of those have signs which suggest that their blood is perhaps tending towards forming blood clots a little more. Now, we haven't found in our patient groups that we've had a great number of patients who've had large blood clots, but again, it's this sort of potential for this being microvascular changes, so that's the very smallest blood vessels, either being inflamed or being affected by these small blood clots, which could be driving some of the symptoms. So you will see a lot about blood clotting on social media. Now, at the moment, there are no licensed treatments for long COVID, and the process of licensing is there to protect patients from people suggesting treatments which may have significant side effects or might be unproven, and we don't know that they're beneficial. And so this is one key area, is looking at whether addressing blood clotting might be a way to get people to improve. Another area which you will have heard about is viral persistence, and there is emerging evidence that patients who have symptoms of long COVID have some evidence of some parts of the virus still detectable in their bloodstreams. Now, no one has quite worked out if this is because of ongoing viral replication or whether it's an immune response, but there is an increasing amount of literature looking at that. And again, that's one of these things which we're hoping to study as we go through the Stimulate ICP trial. So the blood tests which are being taken are being sent off to various key laboratories for looking at whether those theories around viral replication still are driving the long COVID. Another area of research is the mitochondria. That's the top right picture. So they're the batteries of the cells. And what they do is they help to turn glucose into energy. And again, there is emerging evidence that the mitochondria are being affected by COVID in the acute illness, but then the lingering effects of that can have an influence on how people are experiencing their illness. And as I mentioned with the Stimulate ICP trial, the final thing is rehabilitation. It's a really important area. We are looking at rehabilitation within Stimulate, and there are lots of other groups which are looking at what sort of rehabilitation is the right thing. And I think Rebecca is going to talk a little bit more about that in a moment. So if we go on to the next slide, please. So this is just again to sort of illustrate what we're up against as both patients and as doctors. If you just do the next animation. So as you can see, these are the pathways of physiological pathways of the different processes that happen within each of the cells of your body as they've been described. It's hugely complicated. And one of the things which we're trying to do as clinicians is really track down which bit of this huge complex system is the one that's being affected in long COVID, so that we can try and find a useful treatment. So then if we just move on to the next slide. This is this is a way of looking at how people experience COVID and their recovery, which hopefully will be familiar to some people. So the red line is sort of what we would anticipate for people recovering from COVID. They become unwell and then there's a gradual improvement. The green line is people who have suffered an early complication from COVID. And these are the things which we're looking out for when we see people in clinic, is to make sure that we're picking up on complications which we can identify and treat. And then the third group, which is patients who have got stuck as they recover and seem to have this fluctuating or variable experience of COVID. And that tends to be the patients that end up with a diagnosis of long COVID. And it's those patients that form the majority of those that we see in the clinic, and we're trying to help out with this, with the service and research. So if you move on to the next page, and so the next slide is really just to illustrate that at the moment we don't have a cure for long COVID. We don't have something which is sort of transformative as soon as you take it. But what we're trying to do is to bend the trajectory of somebody's recovery, so that instead of being one which is up and down and eventually sort of bobbling along the bottom, we're hoping that we'll be able to get people to see improvements over time. And it's not it's not a simple line, but instead it's often an up and down process with quite a lot of experimenting. But we'll hear a little bit more about that, I think, as Rebecca talks. So that's my slides finished. I'll hand over.
So over to me, and we wanted to talk a little bit about the treatment strategies that we use within the long COVID services. And although it's not straightforward, it's really important to say we are seeing good recovery in many patients with these rehabilitation approaches. And that makes us feel that we should be able to achieve those good responses for all the people that we see. But we know that it's still quite a variable journey, just as Toby was describing. And rehabilitation for long COVID is something new that we've been developing, learning about and improving over the last 2 years. And over the course of this webinar series, we're going to do a bit of a deeper dive into some of the particular aspects of it. So managing your breathing pattern, managing tiredness, fatigue, how to get back to work and how to recover some of your physical fitness and keep moving. And what's fundamental to all of these approaches is that you, as the person who we are supporting, are key to the success. And in developing the plans, we want to develop these plans with you to match your priorities and work out what are the right goals for you and the right ways forward, because a different approach is needed in each person. And as with all human illness, the mind-body connection is really important to encourage your recovery to be as effective as possible. And that will be addressed in all aspects of trying to manage your long COVID. And some people might benefit from additional treatment from the psychologists within our services in trying to define the best strategy for them in supporting their recovery. Now, we wish we had a pill that would take long COVID away, but in fact, the role of medicines remains quite small, but they are useful to help some symptoms, for example, headache or people who have very difficult palpitations, and we'll make recommendations about prescriptions where we think that's useful. And of course, you will read about other treatments that are being proposed and researched at the moment, and some of these are quite dramatic treatments, and I'll mention some terms: apheresis treatment, hyperbaric oxygen, triple anticoagulation. And we're keen to answer your questions about these treatments, but it's important to say that at the moment, none of them have been researched enough to be safe to use in clinical practice. And the institution I mentioned before, the National Institute for Clinical Excellence, are tracking all of this research, and they will advise services in the UK about when we should be using new treatments that are being proposed. And these clinical trials are so important for your safety. We know from experience in medicine that it is possible to do more harm than good with new treatment approaches if we don't test them out properly. And of course, we're learning all the time. And I am conscious that we do pester you as our being under our care with filling in these questionnaires through the MyChart portal that we use at UCLH. Thank you so much for doing those. They are immensely useful for us in actually understanding this condition and in trying to improve what we offer to you. So thank you. And then next slide. Because we don't have that magic cure, the things that you do yourself to help manage your condition are in many ways the most powerful part of the treatment plan. And we want to see that improvement in time. We know how frustrating it can be, and it can be quick and it can be very slow. But there are more and more resources out there to try and support you in this journey. This webinar is one approach. There are websites available, YouTube videos, written information, and some of the teams who work with people in North Central London will use a digital app if that suits you. So we'll try and make you aware of all these different resources available. So I think I'm handing over to Rebecca now.
Thank you. So obviously over the next few weeks, we're going to look a little bit more deeply at the different components that can be helpful in terms of managing symptoms and helping to improve things. But what I wanted to do today was just to draw out a couple of key themes for us to sort of hold in mind as we go forward with the series. So the first thing is just about how we often see symptoms interplaying for people. So I think that this was really sort of a steep learning curve for us at the beginning, for example, looking around breathlessness when we were kind of retraining people's breathing patterns. But actually, if we weren't keeping an eye on their fatigue and their psychological health, often we would struggle to make progress, just kind of taking a single approach. So, you know, often we see an interplay between symptoms, and often we see for people that these flare in clusters. So if people have a flare of symptoms, it's usually a few at a time. And so that's why when we look at this this program, there are several different themes that we kind of want to pull together in terms of managing symptoms. The other thing to say is that every case is different, and that's something that's been, you know, a huge challenge for us in clinic, and I think is a huge challenge for patients as well, is that there's huge variation in how people experience their symptoms, how they present, and in their recovery trajectories as well. And so giving you hopefully some of this insight is helpful so that you can apply it to your kind of own personal situation as well. And so helping one symptom, addressing one symptom here with these techniques can have a big impact on the other symptoms that you're experiencing as well. So James, if we can just have the next slide, please. So I wanted to just touch briefly on this dysregulation theory, which is something that many of you might be experiencing. And you know, after a viral illness like COVID, often what we see is that your body's ability to kind of regulate and control things is affected. So our autonomic nervous system is made up of our sympathetic and our parasympathetic nervous system. Your sympathetic nervous system is your fight or flight response. And that's something, you know, you'll recognize if you've ever been, you know, sat waiting for an interview. You can feel that response in your body, you know, the quickened heart rate, perhaps, you know, you might breathe a bit quicker, you might feel a bit more on edge. And then there's your parasympathetic nervous system, which is your rest and digest. And that's really important for your body to have recovery time. And what we think we see often post-COVID is that your body's ability to switch between these two systems isn't working quite as well. And it should be like a finely tuned dial that your body can just turn up or down to sort of adjust your body's needs based on the situation around you. But post-COVID, what we think is happening is that instead of it being a finely tuned dial, you end up with it clunking from one extreme to another. And your body's just not as adept at regulating some of these symptoms. And so that's something to have in mind, perhaps as an explanation as to what's going on when you're experiencing symptoms. Next slide, please, Jane. So I know that you've already seen a few slides with wiggly lines on and different trajectories, but one of the first things that we really promote in rehabilitation is about achieving symptom stability. So quite often what we see is that post-COVID, your body's capacity in terms of energy and resilience is reduced. And so it may be that a previous level of activity that you could do quite easily, for example, you know, doing the school run, for example, is something that your body could cope with, but is now something that is an overexertion, and it can cause a flare of symptoms. So sometimes what we see is this boom and bust cycle where you might have a day where you're feeling well, you might do things that you haven't been able to do because you haven't been feeling well on previous days, and it might be beyond the capacity of what your body can manage at the minute, and you might end up with a crash or a symptom flare. And so one of the first things we try to achieve is to reduce that those extremes of up and down in terms of your symptoms, to achieve a little bit more stability by, on a good day, doing a little bit less, and trying not to tip into symptoms, and being really mindful of triggers. And this can feel quite limiting to begin with, but what we then tend to see is that we see an improvement in trajectory with less symptom flares, which is then a point at which you can build activity. So this is something to sort of, again, hold in mind as we go forward. And everybody on this webinar will be at a different stage of that. And that's why it's really important that your approach and your rehabilitation is kind of tailored to your needs and to your symptoms. Next slide, please, James. So this is just to give a little summary of what we're planning to cover in future sessions. So we have a session on activity, how to manage fatigue and how to get moving again. And you'll hear a lot about sort of the body battery and strategies to kind of help with fatigue. We've got a session on breathing, so looking at how to improve breathlessness, particularly around optimizing your breathing pattern. We've got a session that's talking about nutrition and sleep, both of which are hugely important. And as we talked about, perhaps with the dysregulation theory, you know, your body's capacity to function sort of well and finely tune things is hugely reliant also on, you know, how you eat and how you sleep. And so there will be some looking there at how we can support those. Your psychological well-being is also really important. We all recognise, you know, in pre-COVID times, the impact of stress on our bodies. And so we need to think about that emotional exertion as well. We also have a session on work and cognitive function, so thinking about brain fog and how we can support strategies with helping people get back to work as well. So lots and lots to come in a lot more detail, but just a whistle stop of what we will be bringing in future sessions, and hopefully some context to be able to apply some of these strategies as well.